Well, exactly 9:32 and 18 seconds. You're hooked on to the only truly live station of the nation, 91.9 Friends FM, with all the closeness, all the warmth, absolutely live. Well, right now I'm going over to an amazing personality, an iconic person. A person who's made a difference right there. Hospitals setting up, engaging, and creating amazing integration and a beautiful positive feeling. Well, I'd like to welcome Dr. Rupali Basu, CEO of Woodlands, which is one of the oldest and the finest hospitals in the country. Ma'am, a warm welcome to you on 91.9 Friends FM.
Thank you so much, Jimmy. Thank you so much. It's feeling so good to be here with you and all of you, and all the listeners of 91.9 Friends FM. Thank you so much for having me.
It's such a pleasure because you're so iconic, ma'am. First of all, a big salute to you. I always say salame dos to you and the entire team of yours and the hospital staff for people who are making a difference even in the trying times, whether it be non-COVID or whether it be COVID. So I'm just going to ask you, in these trying times, how are you managing house, work, family, everything during this lockdown period?
Yes, it's really, really difficult time. Suddenly, absolutely from nowhere, a virus comes in and absolutely makes the whole world topsy-turvy, and in such a serious way. So we all know by now about the disease, about the what is happening to all of us in the several countries of the world, and of course India is not immune to it. We got the virus in our country also. It's about 4 months now. We've lost so many lives. So many people are infected. So it's a very, very difficult time. And as we all know that I say that there are two kinds of people between us. There is and all of us are warriors. So there is a group of people who are actually staying back home, all of us, and fighting from being at home and preventing themselves from the virus, because the virus is very easily transmissible from one to the other.
Absolutely.
And there is other group of people who have to maintain or give the essential services, which are the frontline warriors, which are all of us. So I have not been able to stay back at home. We and the whole team of Woodlands and the other hospitals, all of us who are actually giving the essential services, providing the essential services for all of us, are actually at work. But what we have done is, even at work, which for so many years of my work with the hospitals, we have never done. When I have always been told that I don't like leaves. I like people to be there at work. I want to see them physically. I have also changed, and we have created many types of schedules. Like some of us are actually being at home and not really working at all. Some of us are actually coming alternate days, weekly. We are, some of us are actually doing 3 times a week.
Okay.
We have actually looked at the entire staffing plan and minimize the risk of exposure, if any, to the hospitals of ours. So, different ways of managing our people, so that and a lot of rotation, manpower rotation we are doing at hospitals, so that nobody is working in one particular area for a long time. The lack of knowledge about the virus, although we are getting knowledgeable every other day, is actually allowing us or making us work 24/7. We are gaining new knowledge. We are being given guidelines from the government, and we are operating as it should be operating, and new knowledge is coming every other day. So we are operating in a situation where staffing plan is done in a way that the services are optimal at the hospital, because it's not only the COVID patients that we are looking after, but we have to also look after the other patients.
Yeah, ma'am, there's one question I would like to ask you here. There's a fear among a lot of people, even the non-COVID patients, in the sense that people who have to go for a normal checkup, people who have to go for meeting up doctors, they're too scared to
Absolutely.
even. So what do you have to say about that?
So what's happened is because the disease is so not known, and the virus is the way the death rates are happening. We are seeing all over the media it has been talked about. So there's a lot of scare amongst not only we common people, but among doctors, among healthcare workers, among everybody actually. So we are trying to, with our knowledge, we are trying to address those scares, and we are preparing our organization in such a way that when you come to the hospital, you feel better and you feel safer.
Okay.
So I can tell you that the day it started on 22nd of March when we started the lockdown, the lockdown 1.0, it was actually the hospitals almost closed. When OPDs were not working, doctors were not coming, there was no surgeries happening, almost as if that there was no disease around us. But actually people were suffering, and slowly, end of April, we have started, in the last 2 weeks, I would say, we have been able to really, guidelines have changed, new guidelines have come in, and we have been able to, kind of resume the normalcy in our hospitals to some extent. I won't say fully, but to some extent, because people are also getting aware of the things which they should do. Say, for example, at Woodlands, what we are doing to make it a safe hospital. As you enter the hospital, as you come to the hospital, you will be checked for fever. So we call it fever triaging. You've been actually allowed to fill up a form, a 2-page form, which we do it for you. And then we also, give you directives and guidelines before you come in. So we tell you all that please carry a mask, carry a sanitizer, do your appointment with doctor, so that your time spent in the hospital is as minimal as possible, and you are coming in your appointment time and going away. So we do that before, and when you come, we do your fever triaging. Then we ask you to do, wash your hands, sanitize your hands, and we make sure that you sit in the lounges when you are sitting with the maintaining the social distancing norms. And then when you are going to the OPD to the doctor is actually wearing their face shield and mask, and so that they're also maintaining the social distancing norms of 3 feet. Because as you know, the virus will come out of your cough and sneezes and talking.
Right.
So the droplets can go to the other, the normal person's, nose and throat and nose and mouth and eyes, and will infect you. So you have to prevent that. So that if you know the epidemiology or understanding that this is how the disease happens, then you also, scientifically protect you. So those are the things we are doing. If you have to go to CT scan or your investigations, there will be people will be protected with their protective equipment. And if you are going to the inpatient, you'll be again served by the protective equipment wearing staff. If you're in the theater or surgery, they will be all protected. And we will also have to do the COVID testing, COVID-19 RT-PCR testing.
Okay.
To tell you that whether you have positivity or negativity.
Okay.
Why it is very necessary is that now 80% of our COVID positive patients are actually asymptomatic.
Okay.
And they don't show any signs. When you and me can actually be COVID positive.
Absolutely.
So when you are coming to the hospital and taking a service, we are actually doing testing for all inpatients. So at this moment, Woodlands Hospital, the patients who are admitted in the hospital, everyone is tested, every single person, and they're all negative. Because we are a non-COVID hospital. If the COVID positivity is coming in, then we are, through a green corridor, we are transferring them to the COVID identified hospitals.
Okay.
And they're not at Woodlands. So but then there are COVID identified hospitals. I could have been one. We would have given service. Everybody needs to be given service.
Absolutely.
So that they are being transferred to the identified hospitals, which are all there in the government website, that you can get those images of those hospitals. There are many private hospitals, and of course most government hospitals are also.
So ma'am, I want to ask you, suppose, God forbid, someone had a heart attack, or there's an emergency, or someone is having a non-COVID kind of disease, a heart attack, or could be a pain, or could be a gallbladder, or could be appendicitis, anything. So they can immediately rush to Woodlands, or is there a process, or there's a procedure?
No, what we have done is, because you need to ask about few things.
Right.
Say, for example, initially when the COVID positive, when it started about 50 days back,
right,
you are supposed to ask about the travel history.
Okay.
It's not relevant now.
Okay.
You are supposed to ask that, do you have cough, do you have chest infection?
Right.
So these were all the directives by the government. So naturally we had to put in a person who's a doctor as a single point of contact.
Right.
Woodlands also. So all the admission queries used to go to Dr. Basu. It's still continuing, Dr. Saptarshi Basu,
Okay.
our medical superintendent. He takes care of all the queries and then has a kind of do a conversation with the patient representatives and then ask them to come. You can come to the hospital and then you get admitted. We are almost full.
Okay.
So no issues. If you have any heart issues or any other non-COVID issues, please do come in to our hospital. Even if it is COVID, I would like you to call up the hospital number and have a chat with Dr. Basu. We can always guide you to, if we can't take the positive patients, we cannot take at this moment because we are not an identified hospital by the government.
Okay.
But we will be able to organize the bed or any support.
This is truly so heartwarming because a lot of people need to be guided. People are tense, people are worried, and in these trying times, to be very honest, because you are heading one of the finest hospitals in the country and one of the oldest. What is your mantra in these trying times for people? Because it's important. I would love to hear it from you.
Yes, I do have we just created a little clip on this. I call it pandemic survival tool.
Okay.
You need to be, there are 5 tools which I think we need to carry, all of us. I think the first one is optimism.
Okay.
If you are optimist, you can actually handle many things. You can actually handle many things, and your longevity increases. Your work. You can actually work better if you're optimistic. The second one is, of course, kindness. If you are kind, your happy chemicals do come out, and then you actually are better equipped to handle any distress, any stress.
Okay, wow.
If you are empathy, if you have, third is empathy. Empathy is something which, you have to understand the people in the deepest possible, in a very meaningful way with them. It's very, very important tool to be empathetic at this time. Of course, the fourth and the fifth are, one is resilience. I think it's very important not to get distressed in this time, and you must come back and if you're feeling dejected, depressed, you must come back with more energy, and that is what is the tool which is called resilient.
Okay.
And of course, the final thing is rationality. And rationality is the way you think through your belief system, and you start looking into things with reason, and you can judge things better, and your stress levels becomes much lower, and you can handle things better. Very, very important to be optimistic, to be kind, to be empathic, be resilient, and be rational. These are my pandemic survival.
I think these are the true survival pointers, because if you can kind of build yourself up, be positive, be resilient, be kind, make a difference. I think the body hormones work better. Your immunity system gets better. If you're a happy person, I think you have a rocking immunity system that way.
Absolutely. Yes, it improves your immunity. It brings down your depression. It gives you longevity. It's very, very important to have these tools.
You know what? It's so wonderful to hear it from a lady who has been rocking. I would literally say hats off and a big salute to you. You've truly rocked the hospital space, giving us some amazing, thought processes and systems, which we really appreciate. Ma'am, now, I know we've been talking about lockdown, we've been talking about your mantra, we've been talking about how you all are going about with things, but post-lockdown, whenever it happens, how do you see things, and how do you see moving forward and work forward, especially for hospitals, especially for Woodlands, and especially for the normal human being itself?
As I see it, I don't think that the virus, we still have a lot to learn. This is also still, I would say that this is new knowledge, and we must, not enough research has happened. But still, as I see it today as a public health expert, or, running hospitals for a long, long time, created organizations, I think the disease is going to stay with us for a long time. And till the time we don't really have a vaccine or, very particular medicines for curing the COVID-19 positive patients, we are just doing symptomatic holistic treatment. I think we need to be all careful about few things which will come as new normals in our lifetime.
Rightly.
So we have to adopt to those things. Say, for example, wearing a mask. I think it is going to be with us. Our bags will always carry a hand sanitizer, a mask. Going out, we will always be careful about the other person, the distance that you maintain. Physical. It's not really a social distance, but a physical distance of at least minimum 3 feet away. These things we have to. I think we'll have to carry on with us forever. The industries. I know that industries are changing. The way we are sitting, the way we will be working. A lot of digitization will happen.
Absolutely.
So a lot of work will happen in the digital space. Like our doctors in the outpatient today are doing video consultation. They've started this almost 2 weeks back, and the video consultation people are actually because our digital space has also improved. The quality of the digital consultations are very good, and Government of India didn't approve it earlier, but now they have approved. There's legally you can do that. Previously, doctors never could do it legally. Now you can legally do a teleconsultation. You can see your CT scan reports at home. The radiologist can work from home, and a lot of digital spaces will be utilized for our lives ahead. And I think the time spent if at home increases, in some way or the other, it will be good for us to, I'm saying that I'm going to hospital every day, but I'm also staying back at home for a few days in a week. In the last 3 days, I'm at home, and it's so much nicer to be at home and spend time at home.
I'm sure staying at home.
And I'm doing all my meetings. I've created a little corner in my one part of the house, and I've doing my video consultations and talking and emailing, and all that is happening.
Wow.
But I'm working for maybe yesterday whole night I didn't even sleep.
Oops.
So I just I saw that suddenly that it's 7 o'clock and there's lights coming in. So it's something it's very comfortable, but you are still can stretch and can be at home. I think it's very, very good things are happening. So we have to look at the positives, and we have to adopt to this new normal and move ahead with our life. I don't like this lockdown anymore. I think we need to slowly, kind of
get back into the open, because the air is cleaner, the grass is more greener, the birds are chirping. And you know what? I've realized over the last 2 months, a lot of people who are having breathing problems or various problems to do with pollution, they have actually kind of come down a little.
Yes, of course. The quality of air quality has gone down, gone so much better. Your traffic not there, so no accidents. So much so much clearer. You have seen the river
Absolutely.
and so much of clearer water.
In fact, ma'am, if I tell you, I think 2 weeks ago dolphins were seen near the jetty area, which were after 30 years, because the water's become clear. With this, ma'am, so much positivity is happening. What would be your message to the world? Right now we are live on Instagram, we are live on Facebook, and we are live on the airwaves of the City of Joy. What would you like to tell the world and the City of Joy? Any message you would like to give across?
I think I would like all the listeners of 91.9 Friends FM that just be at peace, be positive, don't feel scared. There is nothing to feel scared. So understand the facts and figures, and we are, I think, all over the media. There are so much of information coming in. Just pick up the right things, right information, and move ahead with life with positivity. And we have to adopt to the new normals. So just be ready, and absolutely few more days to go. There are countries where lockdowns have gone up, and people have come back to the disease curve has come down, and people have started doing living their normal life. But then there are countries where still, the disease is absolutely at the peak. For us, the curve is still up. We have not yet stopped the disease incidences, nor flattened, nor coming down. So we have to still be careful in our country, but for the whole world, I think we need to be very, very positive and look forward to new normals and living our normal life like the way we have always done it.
Well, ma'am, that's been such a beautiful interaction with you. So much positivity, so much knowledge, and so much of, hospitalization forwarding, that it's made us feel nice that yes, if there are issues, y'all are always there with us, always there to help us and always there to guide us. It's been such a pleasure talking to you. Thank you so much for joining us live right here on 91.9.
Thank you so much, Jimmy. Thank you. It's been a pleasure to be with all of you. Thank you.
Pleasure talking to you, ma'am. Take care. Have a super weekend and do catch up on your sleep.
Thank you.
Take care and God bless. Well, that was Dr. Rupali Basu, CEO of Woodlands Hospital, one of the oldest and the finest hospitals in the country. A big salute to her team, the doctors across who are making a difference, whether it be COVID or non-COVID, because, you know, we need to be positive, we need to be go-getting, and we need to come forward and together make a difference. Well, Arijit Singh coming up saying, love me thoda aur. He goes on, Sachi, right here at 9:52:57. Hold tight and don't touch that dial.